right, on the second one, we have medical Spanish. We have to be and to have. Very important verbs in the Spanish language that will help you construct many phrases and questions. So let's get started. You're gonna have to memorize this table, but it's not as complicated as it may seem, okay? These are two of the most important verbs, which are to be, ser, and to have, tener. Now, notice how we have the me, you, he, she, us, you all, and them format. In Spanish, yo, usted, él, ella, nosotros, ustedes, ellos. So if you want to say I am, that would be yo soy. If you want to say I have, that would be yo tengo. If you want to say you are, usted es, or you have, usted tiene. If you want to say he or she has, él, ella, es, él, ella, tiene. If you want to say we are and we have, you can say nosotros somos and nosotros tenemos. Also, and you all, that would be ustedes son, ustedes tienen. You get the idea. And for them, ellos or ellas if it's female. Remember, if it's a mixture of males and females in a group, it would be ellos. Always use the male plural. Ellos son, ellos tienen. Memorize these because you will be able to ask and explain medical scenarios to your patient. Now notice you only technically have to memorize 4, which is this one, yo soy, yo tengo, because these two, when you're talking about you, he or she, it's the same thing. Es, tiene, tiene. When it's about nosotros, it's only applied to us, so or we, should we say. Somos, tenemos. And for you all and them, it's also the same thing. Son, tienen, tienen. Now let me show you some examples that are quite useful. These are some useful phrases. Let's take a look. We are your medical team. Nosotros somos su equipo médico. Now, she is your nurse. Ella es su enfermera. Now, we have the results. Nosotros tenemos los resultados. Now, in order to be successful in this, you want to memorize the conjugations of the verb to be and memorize the conjugations of the verb to have. Now, if we go to the first and third one here, where it says nosotros somos su equipo médico, you can actually skip the nosotros and you can just say somos su equipo médico, which is still technically saying we are your medical team. And same for this one. Nosotros tenemos los resultados. You can just say tenemos los resultados. Now, why is that? Because somos y tenemos is only found in the conjugation for us or we, nosotros. So same goes for soy and tengo. If you want to say I am your doctor, you don't have to say yo soy su doctor. You can just say soy su doctor, because the way that this is conjugated, the soy and the tengo, only applies to me. So you can actually bypass that first word. Hope that's helpful. Now, here are some other phrases that you can use. I don't have the pronunciation on this slide because I feel like you can pronunciate it quite well by this point. If you cannot, just go back and review the other videos. We're going to talk about joint and muscle pain, high blood pressure, medication, and we're going to be talking from the perspective of the patient and also from the perspective of the provider. So let's take a look at the first one. I have muscle pain. Tengo dolor muscular. Now the second one will be I have very high blood pressure. Tengo la presión arterial muy alta. I have my medication. Tengo mi medicamento. Notice how I bypass the yo. It's just tengo mi medicamento. Now, from the point of view of the provider, you have muscle pain. Tiene dolor muscular. Also bypassing the usted because the way that it's conjugated. And when in the context that you're just talking to a patient, you can bypass it. You have very high blood pressure. Tiene la presión arterial muy alta. Here is your medication. Aquí está su medicamento. Okay, now we have another page where we have some negative statements or denying statements. So I do not have medication. No tengo medicamento. I am not a diabetic. No soy diabético. We do not have children. No tenemos niños. And I hope this helps. As always, make sure you review it, repeat this video multiple times so that it really cements into your mind. And before you know it, you're going to be speaking Spanish with your patients. Thank you very much.